page can also be reading those write-ups and be learning from them. I'm sure those write-ups helped. Thank you for some of you that sent message across and was like, Dr. Angie, it's been a while. We missed your videos and all that. Sorry, it wasn't intentional, but I had to pay attention to some things. So how are we doing? Okay, today I want to quickly talk about something, and this is about mothers who are disturbed or concerned or bothered about the development of their babies. Some mothers, because they know that ordinarily most babies walk at the age of maybe 1 year or even some at 10 months, they now feel that something is wrong with a child who has not walked by the first birthday. Okay, I want to quickly talk about that. Nothing is wrong with this child. Nothing is wrong with this child. Allow the child. There is no one fits it all for all children. Some people are fast. Some people are not that fast. Walk at 12 months, some at 14, some at even 16. But if that child gets to 18 months, that's 1 year, 6 months, and there's no sign of walking yet, the child has not started making an attempt to walk, either hold things and walk around, or that milestone has not even been achieved at all, then you can visit a pediatrician to assess that child. If by 18 months, the child doesn't walk, or the child doesn't show any sign of trying to even walk, you can take the child to a pediatrician, not to anybody, to a pediatrician, not to a midwife. Because at this point, the midwife will not be able to do much for you. A midwife is someone that is trained to handle deliveries. So take your child to a pediatrician, which is a doctor who specializes in taking care of children. The pediatrician will be able to assess what we call the milestone. There are other milestones, developmental milestones of children. It's not just walking. The pediatrician will be able to ask you some questions and follow the development of this child from delivery. The pediatrician will ask you questions surrounding the delivery of this child, because some things that you are seeing at that time in the life of that child, if there is a problem at all, it's possible that problem must have started when the child was even still in the womb, or when the child was giving birth to newly. Some of these children that have jaundice and it was not properly handled, some of these that had difficult deliveries, some of these things can impact on the milestone of the children, because these things affect the brain. So if the brain was affected in any way, and that is what is causing it now, the pediatrician will sit down with you and try to find out what the problem is. And if there's still time to observe the child, the pediatrician will tell you, Madam, go home, come back at so and so time. Or if the pediatrician, who is a doctor, a specialist in handling children's matters, if the pediatrician feels that there is a problem at that point from his or her interaction with you, then the pediatrician can tell you, Madam, take this child to a pediatric neurologist. That is a doctor who specializes in nervous problem in children. So, but ordinarily, because your other children are very fast with achieving milestones, and this particular child is not as fast as his or her siblings, doesn't automatically mean that the child has a problem. You understand? So if the child is just about 12 months, 11 months, and because the other siblings worked at 10 months, and you feel this one is 13 months, and this one is not working well or is not working, just give the child some time, okay? The child might still pick up. So that's just what I wanted to stop by and drop with us today. So I believe that this video would have helped. So know when to still give your child some time to pick up. Know when to take your child to a pediatrician for assessment. Know when to take your child to a pediatric neurologist if referred by a pediatrician. So keep those questions coming. Thank you for your comments. Thank you for those of you that have shared my videos. Thank you for those that followed the page. I appreciate you all. those are sources of encouragement to me, and I don't in any way take them for granted. This is Dr. Angie. I love you and I love you always. So continue to keep a tap on this page, continue to listening to the videos, watch the videos, read the articles there. They are all to enlighten us and to make us not to be ignorant about what is happening in our body. So thank you for staying tuned today. I'll see you some other time. Bye-bye.